Family doctors are amazing resources. Whatever community you're in, the person who's likely to know where services are is going to be your family doctor. In Ontario, we've got Rainbow Services. Centre for Addiction and Mental Health has a queer-specific treatment for substance use problems, and they can do assessments from across the province. The other thing is that there are individuals throughout the province that are working on queer mental health and substance use care. In Ontario, we have something called Connects Ontario or 211, both of which provide directories of services. If you call and you talk to an actual person and describe that you're looking for something that needs to be queer friendly, they're going to be able to go through things. But in Ottawa, there's MAX, which helps connect guys to mental health services and do patient navigation. In Toronto, we're soon going to have HQ, which will connect with services and offer services alongside sexual health testing. There's all sorts of different mental health providers, and why see one versus another, what their specialty is, and it can be very complicated. So there's psychiatrists like myself. Out of all the mental health providers, I'm able to prescribe medications that others can't. On the other hand, with crystal meth, we have one drug, mirtazapine, that we can use, and very little other options for medications to help with this. A lot of it's about therapy. Then there's psychologists. Psychologists, like psychiatrists, spend a lot of time learning just about mental health. So if you need a specific type of therapy and you want to go to an expert in that therapy, they're most likely going to be a psychologist. Social workers often are the most common therapists in our communities. They don't always learn therapy in their training programs, but often once they graduate, they can take more courses and learn how to do therapy for specific types of problems. And so while they can't diagnose a problem, if it's pretty clear to everyone what the issue is, sometimes they'll have the tools they need to help you with that. There's a new category in Ontario called a registered psychotherapist. These are individuals who've learned a specific psychotherapy modality. Like the social workers, and unlike psychiatrists or psychologists, they can't diagnose. They've not been trained to know and identify for sure what the problem is, but they've learned how to treat certain things. So those are good places to start. It's useful if you want to help someone who's got a problem for you to go and get some information for yourself. That might mean finding a therapist or a counselor. And there's a few therapies that are actually designed specifically to help people who want to help a loved one who's currently refusing treatment. There's also just supports often in residential and other treatment programs to help the family and to increase communications. And if you're part of chosen family, it's important to point out that you're part of their family in a way and get involved with those things as well. There is a therapy called CRAFT. It stands for the Community Reinforcement Approach Family Training. It's a therapy where we can train your family, your loved ones, to do some of the principles that we would do in therapy. And those principles include understanding what's the function of this, what's it doing for the person, and trying to figure out what else could they do that would get that need met. Just reminding them there's other things they enjoy in life can be super helpful. And the other is about allowing the natural negative consequences to occur. Often when people have their substance use happening, we don't want them to suffer. We rush in then to rescue them from the negative things that are happening. And sometimes you kind of have to face down the consequences of your actions to finally say, this is costing me too much. I need to make some changes. It works better if you live with the person, it turns out, than if you don't. But that approach has about a 70 to 80% chance of getting a loved one into treatment.
You can't force someone to change if they're not ready to change. You can't force someone in the direction that you think they should be taking. You have to work with the person that's in front of you. And so my profession has limits, and I need to respect those limits. And often with some people that I'm less sure how to help or how to support, my first step is to try and get them like a caseworker, a good doctor, a good pharmacist, friends, family, increasing the supportive care. So that's something that everyone can do kind of as a first step, because regardless what your job is, if you're the only support to a person, you can't do that, you're gonna burn out. So learning where you have to set your limits and then increasing the number of people that are gonna help this person, I think is kind of like a second thing that you can do.